Well, hello and welcome to section 10.4 of the book Transgender Ideology and Gender Dysphoria, A Catholic Response. This is a study guide that goes along with the book in case you're not aware of that. There's a link for the book below. You can get it on Audible or Kindle, softcover or hardcover. You can get it any type of version you want. Or you can just follow along on the video if that's most helpful to you. We're looking at the least invasive means for addressing the transgender issue. And now we looked at step one, which was the medical approach, right? What does medical science have to say? What is the good counsel from medical science, the medical professionals? Then the second step was looking at trying to restore the natural order to things, right? That should be the goal of the medical science, is to restore the natural order. And then lastly, to do it through the least invasive means possible. So this is another judgment, and it's a result of good counsel, is that we should use the least invasive means. And this step comes from Male and Female. He created them, a document 2019 from Catholic Education Department. Said instead medical science should act with pure therapeutic ends and intervene in the least invasive fashion on the basis of objective parameters and with the view of establishing a person's constitutive identity. Right. So in some ways this is a combination of the previous one and this current one. Right. It's both seeking to restore the natural order in a holistic way, and it's trying to do it in the least invasive way. Now this can be a bit of a challenge, right? And because the end goal for these treatments is psychic easing, right? There is no such things as sex reassignment, right? A woman could never biologically be a male under objective criteria. Women could never be a man, men can never be a woman. And this isn't just saying, oh, you can't change the chromosomes, but you can change everything else. It's far more complicated than that. And if you want to go back to earlier chapters, we can go in the difference between men and women. Go back to chapter 2, for example. But these things are so rooted in us that it's not one thing. It's the way our brains are structured, hundreds, if not thousands, of different elements of this in our brains, the size of our hearts, the density of our bones, the amount of testosterone or estrogen, right? There are thousands and thousands of factors which determine male and female, not just one. Now there is also a very important piece of this which relates to reproduction. What makes a man, and that is the ability to reproduce in another. And what makes a woman female, it is the ability to reproduce within oneself, right? So this can never change. You can never have a reassignment of this, right? It simply is what it is. All we can do with any types of treatment for gender dysphoria is a type of psychic easing, right? Even a person who transitions from male to female is really only doing so socially and personally, not biologically. Therefore, it's out of a psychological easing that they feel more comfortable, right? This is a big piece of it, is that you're feeling more comfortable. And there's a lot of times when we do this, where we do things to make ourselves feel more comfortable. Something as easy as women putting on makeup, right? Why do we do this? To feel more comfortable. To dye our hair when it's getting white on top, right? To be more comfortable, right? Hair growth therapies, be more comfortable, right? Why do we go to the gym? Well, there's a health dimension, but another part of it is to look good and to feel more comfortable, right? So we can't discard psychic easing as insignificant. It's a very major component of a lot of things we do as human beings, right? Psychic easing. the question is, to what degree is it healthy, right? So if we were to look at Michael Jackson, for example, right? The degree in which he had received cosmetic surgery was probably too much, right? He was doing it for his own psychic easing, but it became in itself a disorder in many ways, right? So this is the challenge, right? Not just to the transgender community, but to everyone. When we can make the claim of psychic easing, we can go really far down that rabbit hole, right? So the wisdom, right, the virtue which comes in the next chapter focuses on learning to love yourself the way you are and needing the least amount of psychic easing, right? Jean Vanier is very good at this with people with disabilities, right? A person who's wheelchair bound and with severe mental deficiencies. If this person can love themselves, then why can't a very able-bodied, healthy person with full intellectual capacity do this, right? Well, if you could do this in a very broken body, how about in a very healthy body? You can't love that yourself or your body, even when it's very healthy, right? It's kind of a trick. But we do, but on the other hand, we do allow for a certain amount of psychic easing, right? So a woman has breast cancer and one of her breasts is removed. We don't make a woman go around walking around with just one breast, right? You'd either remove both of them, or you might get a boob job, right? You get one added so that you remain balanced and harmonious, and you can't tell that a surgery's been done, right? If a person is a burn victim and they have scarring on their body, we don't have any problems with people getting cosmetic surgeries to remove the scarring from some type of a burn, right? There's many things we do which are perfectly acceptable for psychic easing. It's just how far can you go, right? It's not a black and white issue. It's a gray area issue. In terms of modifications, is this allowed? And I know that's a very debatable issue with the transgender community. They hate when you say things like mutilations or amputations or things like this. But you have to be honest that, if we were to say, well, what is these surgeries? Well, a lot of times they are some type of amputation of a healthy organ, or sterilization, right? As a secondary effect. These are the consequences. So if we look at the catechism, right, because we don't really have a clear church teaching on transgender surgeries, but if we look to the catechism, the area where we might find some guidance would be on this section 2297, which points to amputations, mutilations, and sterilizations. But these are really sections that are against torture or kidnapping or some type of forced brutality to somebody, right? It's not really about transgender, right? So it's important not to stretch it too far to this. Some other advice says, except when being performed strictly for therapeutic, medicinal reasons, directly intended amputations, mutilations, and sterilizations performed on innocent persons are against the moral law. Right? So then the question becomes, is it strictly therapeutic? Right? And if you were transgender, you would claim it is strictly therapeutic. And if you don't believe in that type of thing, you might say it is not therapeutic. So it becomes a question of back to the medical science in some ways, back to step one, right? Are these treatments therapeutic, right? If you look at the Digen study, the Swedish study, you say maybe it's not therapeutic, right? It could lead to all other types of problems. If you look to some of the psychological studies of contentment, right? If all of the underlying distress and anxiety and dysphoria remains, maybe it's not helpful, right? So this can be debated, right? It'll be debated. But I think I've laid out a lot of evidence up to this point that says it might not be the best the surgical route may not be the best approach therapeutically, right? If you disagree with that, then that's a different story, but you have to look at that data and be able to say it's incorrect, right? Or come up with a different narrative. Another catechism point is if morality requires respect for life of the body, it does not make it an absolute value, right? So the body is not an absolute value. It rejects the neo-pagan notion that tends to promote the cult of the body, to sacrificing everything for its sake, an idolization of physical perfection. Now, this is more true with just general cosmetic surgery than anything, right? If you look at the amount of boob augmentations and things like this, very, very high rates of plastic surgery in the West and even in the East, right? Thailand, places like that. Is this an extension of this idolization of the body? Right, that's a question. We looked at this a bit in chapter 3. Right, we looked at this a bit there, but it can go both ways, right? There are some people who are obsessed with the body, and this is part of an obsession, right? I want to look like this type of girl. I want to look like this type of man. I want to, I'll be happy when I get a beard and I get muscles and I get this, or I'll be happy when I have more feminine features, right? That their happiness is contingent upon a certain amount of externalities, right? This would be an idolization of the body. There's other people who are just looking to get by, just looking to survive, looking not to be attacked, right? For looking like a man in a dress, right? Or whatever, what have you, right? They're not looking for ideal perfection. They're just looking for some type of psychic easing, right? So again, within the standard society, there's a range of people who are going from idolization of the body to just looking for some psychic easing, and within the transgender community, the same spectrum exists, right? The same unhealthiness with the body exists in both sets of communities. It is more a human issue than it is a transgender issue. Now, some people claim that we can do things like amputations, mutilations, and sterilizations because of double effect, right? This is a Thomistic idea where the direct thing you intend to do is not the thing that is done, right? So kind of a popular understanding of it would be, let's say a woman had cancer in her uterus and she also has become pregnant. Now, you cannot abort the child morally, right? You can't do that. But what if your goal was to remove the cancer, and the consequence, the side effect, was the child would be also removed in the process by removing the uterus? Well, under double effect, if the thing you intended to do was to remove the uterus in order to remove the cancer and save the life of the woman, this would not be an abortion, right? This would be a medical procedure for cancer treatment, right? The unintended consequence is the child will die, right? So this is a double effect, right? It has to do largely with intention. What are you intending to do? So Carol Bailey, who is the Vice President of Ethics and Justice Education at Dignity Health, which is a large Catholic healthcare cooperative of, however, the hospital system network. She says things like, in the case of bottom surgery that will sterilize a person, I believe that we can use the rule of double effect in a similar way. Sterilization, then, is a side effect of correcting what amounts to a birth defect. It is an unintended but foreseen consequence, right? So she has defined double effect correctly. The question is this really an issue of double effect? It's one of those, every time somebody gets mad, they point to Jesus overturning the tables of the temple as justification for their anger, right? We can overuse it, can be overused as an example to justify whatever we want to do anyway, right? The question is it being overused here? I can see the argument of sterilization being a consequence, right? This does make some sense. The intention is not sterilization. It's true. It's not the intention to sterilize. Some people, they would actually like to be able to have children, but as a member of the opposite sex, right? So the goal isn't not to have children or to be sterilized necessarily. Probably not in most cases. But there is still a question. Your intentions have to be rooted in a reality. Dr. Jensen points this out, a point from Aquinas. Your intentions cannot be constructed in the clouds, right? So if what you're saying, well, what I intended to do was to turn a woman into a man. Okay, that's what you're intending to do. But is this something which can be done in reality, or are you talking about a fantasy constructed in the clouds, right? So if the thing you're intending to do is not possible or probable, then it might not justify your actions, right? So say, well, it's an unintended side effect, right? Sterilization, unintended side effect of a woman becoming a man. Well, but a woman can't become a man. So what are you doing? You're doing surgery in order to socially transition. The result of your social transition is sterilization. Is it worth sterilization for a social transition, right? Or is this just constructed in the clouds? And I think that's a fair enough debate. So anyone who uses the argument of double effect, well, the conversation should then be around about this idea, in my opinion, about being constructed in the clouds. Is this a reality? Are we talking about a reality, or are we talking about a fantasy? Because intentions cannot just be anything I intend to do, right? In that case, with the abortion issue, well, you could abort the child because what you intend to do is to turn the child into an angel, and then as an angel, they'll save the world from the Antichrist, right? This might be your intentions, but this is an insane idea, right? So every insane idea with good intentions is not to be followed, right? And use the Thomistic principle of double effect, right? Now there can be different responses, right? So let's say you say there is gender dysphoria. The person has legitimate gender dysphoria. This is different than following gender ideology. Let's say the person has gender dysphoria. Yep, it is. It's there. Let's say we even go as far as saying, there's something in the brain which is causing them to think this way, right? There's a biological ideology even, right? If we go all the way, right? Everything they claim. It's a woman trapped in a man's body. It's a man trapped in the woman's body, right? We accept the most extreme form of this, right? The question is still, what is the least invasive means for treating it? Given that the only possibility is psychic easing, what is the best way to ease, do psychic easing for somebody who has gender dysphoria, right? Right, giving the full breadth of acceptance, right? Except not going down the road that can actually be a biological transition, right? Because there can't be a biological transition. But other than that, fully accepting it, right? What would be the response? Well, I think Blanchard is really helpful here, and I know people will disagree, but I think that it's true, right? So the cause of the dysphoria for androgynophilic people, there's some type of extension. So there's some type of extension of transvestitism, right? I know people don't like this, but there's some type of sexual or sense of satisfaction with wearing opposite sex clothing. Now, as an example of this from a friend of mine who's a priest who was helping somebody, remember, autogynophilic people are often quoted as being, the trucker in a dress, right? That there's they're often unconvincing and they transition much later in their life. Well, as a result of this late transitioning and everything, if you're Bruce Jenner, you can spend millions of dollars to become Caitlyn, but for the average person, they can't afford that type of treatment. If you end up with a 60-year-old guy, 50-something-year-old guy, and he has not a lot of money, and he's married, and he starts wearing women's clothing, he's not going to be convincingly a woman. No matter what he does, he will never look like he hopes. Right? That's just a reality. So what could be a better option for them, right? And so this is what my friend Father Nick pointed out, helping somebody, what is the least he needs to do to relieve the majority of the dysphoria? That's the question, right? What is the least you need to do? Not what is the most you can do, but what is the least you could do, right? So you feel more at ease when you're wearing women's clothing and you're possessing some type of femininity. Well, in a discussion with the person, came down to, if he wears women's underwear, it's enough to feel at ease, right? At this point anyway, right? To feel at ease, right? And that's enough. And then I think even going away for a retreat, once a year for a weekend or something with a group of cross-dressing people is enough to get him by, right? So he's dressed as a man, looks like a man, he's wearing women's underwear. Nobody knows this other than him and his wife probably. But the result of this is his marriage remains intact. If he were to start dressing like a woman and start taking hormones, he would never convincingly look like a woman, so he'd be a victim of ridicule, could be attacked or abused in some way. Again, marriage might fall apart. Negative health effects of taking estrogen and things like this when you're, there are many negative things to go all the way. If you go all the way, there's a lot of negative things. And would you really feel fully satisfied at the end of this? Probably not, right? Probably not. Just part of human psychology. You're never going to be as good as you hoped you would. So just this one thing, wearing women's underwear, going on a little retreat once a year, is enough to take care of the psychic easing. This isn't such a bad thing, right? This is not, if this is what helps him, there's probably no objective sin in this, right? It's certainly not a moral sin, a mortal sin. There's nothing even that intrinsically feminine about lace, right? Men wear lace, right? Do wear lace. So this would be a better option than the surgical approach, right? So if you go to a doctor and say, I'm trans, and they go, okay, we'll get you on the hormones and we'll get the surgery scheduled, and a year later you'll have all this done, right? This might not have been the best approach for this person. Just put on some female underwear and go on and live your life, right? This would be better, right? But for a doctor to recommend this now would be seen as transphobic or something else. But this is practical sense, right? And the least invasive means. Now, this would not work well for what we know about androphilic, right? This is kind of homosexual type, a boy that's so feminine that he says he's a girl, or a boy who's so masculine he believes he's a man, right? This would be different because what we know from autogynephilia is that it has a lot to do with the clothing and the eroticism with the feminine. Androphilic, there's no eroticism. There's nothing about the clothing. The clothing does nothing. It is appearing as, right? There's an appearing as that causes some of the dysphoria. And, but again, does it have to be fully surgical, hormonal, etc., right? Do you have to go the whole way in order to find psychic easing? Right? If we look back to history, people like Billy Tippin or Little Axe, Broad Axe, right? These were female to male musicians who lived as men, but they had no hormone or or surgical procedures, right? So if you simply, present as a more masculine female, well, just, some people might confuse you for a lesbian. Who cares, right? Does it really matter what other people think about you, right? If it matters so much what other people think about you, that's something to discuss with a therapist, right? So if people say, "Well, I see you as a woman," they see me as a woman. Well, whatever. I don't care. I don't. It's not an insult to be a woman. I'm not a woman. If you think I am one, it doesn't really matter, right? So for it to matter so much to somebody else, what people think about them is probably an issue, right? Just be yourself, right? If you are a woman who wants to wear a suit rather than a dress, be a woman who wears a suit rather than a dress, right? It makes very little difference to me how you dress or how you present yourself. Right? It doesn't require hormones, right? This idea now that if you're a female and you're a man now, right? I need to have a beard, right? You need to have these men. What does it? There's plenty of men who don't have beards, right? It doesn't really matter. Just accept yourself, right? Another one would be like Blair White, who has had quite a bit of plastic surgery to feminize, done a lot to feminize, but has never had bottom surgery, right? Never, still has a penis, even though a very feminine person. In my book, you can see a sketch of her. To the outside world, very feminine, right? Very much appears to be a woman who's had a lot of plastic surgery, but it still has male sex organs. And she had said on videos saying, it's a very invasive procedure, and it doesn't cause a lot of her dysphoria because only her and her husband see it. Therefore, why do something that's very complicated medically when it doesn't have any real effect on her life, right? So this is another example. Like, this is a full trans person, fully trans, right? Gone for it all the way, except you don't need to have all of these medicalized approaches done, right? It's not necessary to remove all dysphoria. It depends on the individual what dysphoria is needed. Again, people go now to the clinic and it's like, we'll just give you the whole thing. Let's just sign you up for everything. Not necessarily the best approach. There can be intermediate steps. Right. Another thing is uncertainty. Right. There's a lot of people who are in this category and they are very uncertain. So Rachel Ann Williams, who's very much a trans activist, progressive liberal trans activist, gender theorist, she says, "I'm a tranny. I'm a trans woman, a trans person, a non-binary trans femme, whatever. I don't know what I am." But she does say, my body is now intrinsically linked to the pharmaceutical, medical, industrial complex, right? Kate Bornstein says something else, like, I don't know what I am, right? This is a common theme you see among this kind of fourth wave transgender ideology, which is wrapped up with the trans movement, right? It's I don't know what I am, right? It's fluid, it changes, I'm non-binary, I don't fit in any type of category, etc., etc. With this level of uncertainty, then, is the response to medicalize these people, right? Is that the best response? It's like, well, I don't know what I am, so I'm going to cut off my breast. I don't know what I am, so I'm going to take opposite sex hormones. This type of experimentation should be discouraged by the medical community, right? The medical community should listen to what they're saying, what they're feeling, what they're thinking, and should create a good diagnosis and a therapeutic plan to help unify these ideas, right? To create a unity and a healthy therapeutic approach, right? It's not, well, I think I'm trans and I just want this. I just want the hormones. So give me the hormones. I just want my breast removed, so give me my breast removed. I just want this, so just give me that, right? Patients don't, especially when you're dealing with psychological things, patients don't just determine their diagnosis, their treatment, and the plan of dealing with it, right? It's up to the doctors to make the best judgment. So wait and see, right? This is a far healthier response for a lot of people, especially the people who are in the uncertainty category, right, or the non-binary or whatever other, agender or something, right? The better approach to responding, rather than the medicalized approach, is the therapeutic approach and the wait and see, right? The psychological easing, right? Take care of the depression, take care of the anxiety, take care of all these other issues, and then start to address the gender issue. But wait and see, right? If they don't have any type of clear idea of what's going on within them emotionally, then how do you follow their conclusions? And this is very different than the current method. You could be hearing this and think, well, isn't this what you do anyway, right? But the least invasive method is not the approach taken. Not in most places in America anyway, right? So people like Johanna Olson-Kennedy, who runs the Center for Trans Youth Health and Development at UCLA, not a small thing, right? I pick on her a lot, which nothing personal, but I just disagree with her ideology, right? Remember, she is married to a transgender person, a female to male, who transitioned around 30 or something, right? And so, but I think she might be projecting onto the youth things she thinks about her husband, right? And there is a difference between transitioning at 30 and transitioning at 12, right? You can't say, well, because my 30-year-old husband transitioned, therefore 12-year-olds are just like my husband. This is not necessarily true, right? So in her study, she developed, a few years ago, I forgot to write down the date, a few years ago, she had 94 female to male youth, ranging from 13 to 24 years of age, right? So young people. Half of them were below the age of 18. Half were minors, and the study followed an outcome of the youth having double mastectomies, right? Both their breasts removed because they were transgender, right? That's the idea. Well, the consequence of removing the breast, right? The response was, she said, 94% of youth reported that the mastectomies was extremely important, and 67 out of 68 subjects reported no regret. This is what she claims, right? In her report, Dr. Olson-Kennedy stated, self-reported regret was near zero, right? So this is her reporting. So 2018, that's when the study came about, right? So near zero, right? 67 out of 68%, even though that's 94%, right? It is no regret, right? So you say very high success. So she gets, on TV and interviewed by the press and go, there is a 0%, near 0% regret rate among female to male youth, right? Therefore, we should do it, right? People don't regret it. They are happy that they did it. It's very important to them. We should do this. Why withhold this from these young people? But there's some problems with these studies and with her reporting. So things like the study ended 1 to 5 years past surgery. Now, recall some of these people were 13 years old, so that you remove the breast of a 13-year-old, and now when they're 14 years old, they don't regret it. That doesn't mean very much. The person was 13 and now they're 15, and they don't regret it. It's only been 2 years. It's only been a year, right? It's not long-term follow-up, right? the lack of long-term follow-up makes it so that these results are not that accurate, right? The longest period is 5 years, short-term, right? It's still short-term follow-up at 5 years, and that's the longest period. The other thing is, of the 94 people who received the double mastectomies, two of the people responded that they will not fill out the surveys. So two wrote back and said, nope, not doing the survey. But also another 24, which is 26%, never returned the message, never responded. So she's performed the surgery, she's treating them for transgender, she's trying to get follow-up, and there's, she's lost 26% who just won't respond. So if we were to look at this again, right, near 0% regret, or 71%, right? Because 29% of people didn't respond or said they weren't going to respond. So 29% did not respond, and 71% said they were happy. So we're not at near 0, we're at 71%, and we're only dealing with short-term follow-up. Wait 10 years. Let's see in 10 years, right, where these people are at. 15 years, right? The 71% will go down, right? Don't know it for an absolute fact, but that's much more likely than the satisfaction rate going up, right? When you're dealing with 13-year-olds making decisions, good chance they're not going to, 13-year-olds got tattoo, and ask them years later, would they be happy with the tattoo? The answer would probably be, some people would say no, right? Her study is also highly unethical, and a lot of the treatments for transgender, particularly youth, are unethical, in my opinion anyway. So, in addition to the 94 youth who had double mastectomies, there are also 52 additional youth who were considered for the study, but they were ineligible because they didn't even have enough breast tissue, or they were taking puberty blockers, so they didn't develop breasts. So 52 youth who they were willing to do the mastectomies for, they just didn't have enough breasts to remove, right? It seems unethical to me that you'd be removing breasts of children so young that they don't even have breasts, right? It's a bit of an extreme perspective, that you'd even be considering this. Another one is that when people brought up, well, what if they changed their mind, right? They didn't want their breasts removed. They're 13 years old, right? Maybe a 13-year-old doesn't know what a 13-year-old wants. Dr. Olson Kennedy points out, if you want breasts at a later point in life, you can always get them, right? It's just tissue, right? You can just replace your breast with silicone and it's perfectly fine, right? The teleology that breasts are really intended for feeding your children, right? That's not in the equation at all, right? This is we're talking about an entirely different world, right? Entirely different set of ideology. And to think, well, this is a strange study, but how common is it? Well, places like in the state of Oregon, a 15-year-old can get a double mastectomy for being trans without even having the parents' consent, and it's covered by Oregon's health insurance, right? So you can get a free breast, your breast freely removed if you're 15 years old, and your parents can't say anything about it, right? This is considered basic rights. It's called basic rights under the Transactive Gender Care Bill of 2016, right? This is not the least invasive means, right? It's not our current approach, but it should be, right? That's what I'm advocating. It should be the least invasive, right? Start with the least as a minimum. Is there common ground? I think there can be, right? I think there can be common ground. People like Rachel Ann Williams, who I talked to a couple months ago in person, she says, in a perfect world, being trans would be like having freckles, just as another thing that makes up unique individuals, right? I would agree with that, right? It should be natural. It should be just like having freckles, right? Yes, and when you have freckles, you don't have $100,000 worth of surgery in order to be naturally yourself, right? So if you were a more masculine woman, just be that, right? You're a more feminine male, just be that. You like to approach the world in a certain way, right? With looking at the complexity of brain matrices, right? That's fine, right? Just as Mr. Rogers says, I like you just the way you are, right? Right? This is a common ground I think the church can jump on, right? Because if the church comes off as anti-trans, that's not a framing we want, right? We don't want to be anti-trans, and we're not anti-trans, right? To say we want the best medical treatment for people is not anti-anything, right? That's a pro thing. But where can we reframe our perspective? We want you just the way you are. Just the way you don't have to spend $100,000 to change yourself. You don't have to change. Just be yourself. Right? It's hard to be called a phobe when you're saying just be yourself. Right? It's hard to be called, anti something when we're saying just be who you were born. Right? Just be who you were created to be. You don't have to change yourself in order for that to be true. Right? So I think there is room for common ground here. Right? Does not need to be medicalized. The final issue, and I think this is an important one, is the issue of covenants. So the studies show that 7% of marriages survive once a spouse sexually reassigns their gender. So with this, we're typically talking about autogynephilia, right? This is heterosexual type transgender. So usually the people who are autogynephilic have been married, they have children, they were in the military, or they did some type of masculine type of job often. These are the people, they're men who are attracted to women. These, the androphilic are usually very homosexual, right? Not that homosexual people don't sometimes marry people of the opposite sex, but these are extreme masculine or extreme feminine, male and females, extreme homosexuality. So they're much less likely to be married to somebody of the opposite sex. So if we're talking about autogynephilic people, okay, you have a man who's attracted to women, he married a woman, he has children with a woman, but their marriage falls apart because the wife does not want to continue to be married to a woman, right? She was attracted to a man. So this is an issue with covenants, because if you are a Catholic man and you are married to a woman and you have a family, on one hand you have a covenant, right? You have a sacramental marriage. On the other hand, you desire to be appearing as a woman, right? So on one side is your desire, and the other side is your covenant. What do you choose, right? How important is it to you to dress as a woman, to be called feminine pronouns, and for people to see you as a woman, right? How important is that to you? Is it more important than your marriage? Is it more important than your family? Is it more important than your vow that you made before God? From a Catholic perspective, no, right? One hand desire, one hand covenant. You stick with your covenant, right? You say, but I want to, I feel more comfortable. I want to. Marriage is not about being comfortable. It's not about what you want, and it's not about what you desire, right? But this is my true self. Yeah. Just like 50-year-old men who leave their wives to chase after some 20-year-old girl in a Ferrari, right? Because this was what makes you happy. This is what you desire. This is what makes you, This is your true self, right? Not that old hag that you married 20 years ago. That's not who you are. You're vibrant, right? Your covenant matters more than your desires, right? That's from a Catholic perspective. So that's with autogynephilia. Now let's say the person is homosexual type transgender, right? Androgynophilic. Although it's very unlikely that they're married, maybe they are, right? And in this case, you could look at, right, canon law says, can there be an annulment for a marriage if the person is very homosexual, right? Canon law says the incapacity to assume the essential obligations of marriage, right? That the object of the person being married was not the proper form, right? Not the form. The proper. You're not the proper person for it, because you're not attracted to women, or you're not attracted to men, and you can't fulfill the essential obligations of marriage. In that case, the marriage is going to fall apart anyway, most likely, right? Maybe you can keep the marriage as, this is your friendship. There's ways to keep it alive, but if it does fall apart, there is canonical exceptions for why that could be allowed to receive an annulment. But in general, it's covenantal. To bring it to the next level, there's so many autogynephilic people who have left their families to be trans. There's a website now for trans widows voices. It's for widows of autogynephilic individuals who left their families behind, right? And what they point out here is that while society celebrates the autogynephilic person, the transgender person, for being brave, for being their authentic self, for coming out, for living their truth. For every married autogynephilic who does this, there's a wife and there's children, there's a family left behind, right? There's a covenant that has been breached. Where's the support for the families of autogynephilic people, right? That we don't talk about, right? We just talk about, good for you, go, be yourself, follow your desires, right? That is our society, follow our desires. But it's mixed motivation, I don't know, right? I think from a Catholic perspective, this is fairly clear, right? If you're living your authentic self is to leave your wife and children and go chase after a younger woman, we would not celebrate this, right? Hopefully, right? But it's because of this idea that you are covenantally united with these people. This is your family, right? You chase your desires, or you protect your family, right? Husband, love your wives, even as Christ loved the church and handed himself over for her, right? What is the image of married life? Crucifixion, right? It's not desire, right? It's not what makes you happy, right? Your true self, right? It's not your true self. It's living authentic, right? Authentically to who you are and what you've been called to in your covenants. So that's it for chapter 10. The next chapter is on virtues. I will probably sum it up. Probably, we'll see. So stay attentive. Virtues will be on their way soon.